Hi there, this is Lori Edge-Hughes, and this is your four-leg rehab minute. And in today's minute, I'm sitting out here. It's like supposed to rain, so I'm trying to this is my version of a rain dance. Try and make it rain. Different backdrop for you. Anyways, in today's four-leg minute, I want to talk about manual therapy, mobilization versus manipulation, and really just highlight one research study that made me think about this. So let me read to you. A recent study here that was 2025, February 2025, called "The Effectiveness of Spinal Manipulative Therapy in Treating Spinal Pain Does Not Depend on the Application Procedure, a Systematic Review and Network Meta-Analysis." And this was by Nim et al. In the Journal of Orthopedic Sports Physical Therapy. Okay, so what they did, the goal was here to assess whether spinal manipulative therapy application procedure, i.e. targeted thrust or a regional manipulation, impacted change in pain and disability for adults with spinal pain. So they looked at a bunch of randomized controlled trials. To be specific, they ended up including 161, and which encompassed 11,849 patients. And essentially what they found is that a general, non-specific, rather than a specific targeted thrust technique had the highest probability of achieving the largest effect. And their conclusion was that there was evidence, although low certainty, they said, that clinicians could apply spinal manipulative therapy according to their preferences and the patient's preferences and comfort. Differences between spinal manipulative therapy approaches, spinal manipulative therapy approaches appeared small and likely not clinically relevant. Okay, so where this takes me to thinking and realizing is a bunch of, as I do my clickety clicks, a bunch of times that I have talked about manual therapy in blogs and that before. And I've got a bunch of things, so I would say go log into Foreleg, type in manual therapy in the search bar and find all the different things, because there is lots of different things there that looking at comparisons between mobilization versus manipulation. Is one better than the other? Spoiler alert, no. Then there's ones where it's like, well, when you compare exercise to mobilization or manual therapy, which is mobs or manipulation or whatever in between there, which one is better? It's like, oh, well, and some things will say exercise, some will say manual therapy, and it's like, okay, why would you would never do that clinically? Clinically, you're going to give both. You're going to, for the best outcome and for longer term success, you do manual therapy and exercise. Okay, anyways, I'm now on my little bit of a rant, and it's like, there's all sorts of different things out there. So that I just wanted to discuss. Anyways, now I'm looking at all the studies, and it kind of it makes me mad, because as we are trying to, now I can't see you, there you are, as we are trying to look at what's best for the client, really we are kind of encompassing a little bit of both. So manual therapy is whatever tool really that your hands can apply, but it is an important and integral part of rehabilitation. So do some manual therapy, and in this case I'm talking spine, but really your other joints as well, and you're going to combine it with your other therapies, especially exercise and prescribed, thoughtful, targeted exercise. Anyways, so this is really just a bit of a four-leg rehab minute about manual therapy, so that I can point you to a whole pile of other manual therapy topics on Foreleg. So that's it. Until next time. Cheers.